Welcome to another episode of Let's Talk Small Data with T, where we are passionate about the power of small data in healthcare. I am your host, Tanazia Gonzalez, but you can call me T. Data has certainly changed the game in healthcare. Big data has blown the roof off, but small data, now that's the future. Small data allows us to dive deep into the key insights and take quick, customized action to achieve phenomenal results in performance and quality improvement. Let's explore this today. Thanks so much for joining us. If you have any questions for me or any of my guests, feel free to reach out to me at tgonzalez at eima-inc.com. Enjoy the show. Let's go. Welcome to another episode of Let's Talk Small Data with T, where we explore the power of small data in healthcare. Thank you for tuning in. Today, I'm so happy to be joined by Brian Stark, coming to us from Texas. Brian is the president and CEO of Banta Medical Services, located within the heart of downtown San Antonio, Texas, a place I've never been to and excited to go to one of these days. It's a beyond-the-box, not just outside-the-box solutions provider, Banta Medical Services, that is. Really interested in hearing more about Banta and Brian. Brian dedicates his life to empowering people around the world. He's a former U.S. Army intelligence operative and wounded warrior, and he spent a considerable amount of time recovering in the Veterans Administration and learning healthcare industry lessons and best practices, which he is now leveraging to create a vision of using deep learning to analyze critical data to dramatically improve detection, care plans, and prevention, and pretty much save lives and change lives for the better. He is the ultimate tech geek, and am so happy to have him within my network, and I'm happy to call him my friend. Brian, welcome to Let's Talk Small Data with T. If you can go ahead and turn on your camera, we can get the party started here.
All right. And that's an interesting segue. Thank you so much, T, for having me on your show. And the quick segue into how nerdy I am. If on the video, my shirt says, "Friends don't let friends derive drunk." so so I'm kind of a nerd, real nerd at heart. So it's
very cute. I love that.
Yes, I'm always nerdy like this. So yes, thank you so much for having me on your show. I really appreciate it, T. And these are the kind of things that I love. Connecting with people out there, and whether I connect with one person or not, like it just being able to tell a story and just get things out there for me. So to me, thank you so much.
Definitely. No, thank you. I know you guys are very busy managing your wealth of projects and contracts and everything. I told you that I'm really looking forward to you're my, how do you say, my idol. I'm looking to be more like you and my endeavors and my business. And so I really appreciate watching your journey and learning from your journey. So really happy to be connected with you. I do consider you one of my mentors. So not only part of my network and a dear friend, but great mentor to me. So thank you. And thank you so much, for coming on and sharing your story and what you guys are doing at Banta with my listeners. So as I mentioned before, we have listeners really like across the globe and folks who are interested in this small data thing. And it's not just playing with itty bitty numbers, like my husband always says, but it's about driving into the big data insights, really using the tools that we have in our fingers, in our hands to really change lives, which I know you're all about. So let's jump into it. I mean, tell us a little bit about Brian Stark. What are you passionate about? I mean, I kind of mentioned some of that in the intro, but I'll let you tell your story. And then tell us about Banta Medical Service. What exactly are the core services of the company?
Absolutely. First, let's dive in. Who is this nerdy guy, Brian? Right? Love it. That's exactly how I am. Like for me, I've always been kind of like the oddball in all my groups, and even even in all my relationships, everyone knows that I'm the weirdie. So, and I own it. So, that's it's helped define my personality, and also I think what's kind of set me up to, be a. I don't want to use the term disruptor in the most diluted way, because we hear the term disruption a lot, and a lot of times it's just what is really a disruptor. And for me, it's just like it starts with my personality, and sometimes that can be good, sometimes that can be bad. But
I
I
mean,
like to
you gotta
think
shake it up. You gotta shake it up a little bit.
exactly. And that for me, I never thought that my disruption would really come in the healthcare, which is quite an interesting thing when we talk about the small data, and we'll get to that in a second. But for me, I've always had a passion for everything I touch. And what that means is that whether technology, and my background is former Army counterintelligence, human intelligence, and the funny story to that whole thing, real quick, is how networking really helps, advance. And for me, I enlisted in the military and food service. And within
Thank you.
one,
Thank you for your service, by the way.
thank you, I appreciate
I
that.
know,
So
totally.
I started out in food service of all things because I had such a love for cooking. And shortly after that, I realized it's like, this job's not for me. Working, 7 o'clock in the morning till 8 o'clock at night. My hat's off to food service workers right off the bat there, because it's a lot of intense work with real no life. So
Oh,
I realized I had to get out of this. And this is September 11th, kicks off. I go to Korea and spent a year in Korea. And
wow.
that's when I formulated a game plan to basically just get out of cooking. So during that time, I'm now going to 25th ID. So this is around 2001, 2002. So at that point, it was so funny. I was now in 25th ID. We're about to, deploy out to Iraq for the first time. It was so funny watching Hawaii infantry deploy, because everyone went to Hawaii for the most cush job. Like, you're gonna be on the beach all the time. Like, you
Yeah.
ain't going anywhere. It was like, since the Korean War, 25th ID was going nowhere. Wrong again. And so that was my first experience with the deployment. And the interesting thing of the perception of, if you take a certain job somewhere in the world, that nothing's going to happen, it's gonna be safe, it's gonna be cush. But nope, watching all these people scramble trying to figure out how to deploy. So anyway, so I get to Iraq for my very first duty station, and I cross over from there to technology. So now I'm running an internet cafe, going from cooking to now, and that's a whole long story for another day, but now I'm running an internet cafe, setting up the VoIPs, troubleshooting all the IT equipment. And from there, I go into intelligence. So within 4 years, anyone who knows what the military life is like, crossing three MOSs within a 4 year period is a very hard thing to do. So somehow I managed to do it just by being my nerdy self. And so
And then
that's
you notice you're speaking in acronyms, but I'm just letting it go.
absolutely.
So let's just go with it.
Absolutely. And so MOS is military occupational specialty. That's your job, right? In the military, what you're assigned to. And so whenever you enlist in the military, they give you a classification of what that job is. So which is referred in the Army as the MOS, right?
Okay,
So,
good to
so
know.
at that, yep. So at that point, I realized, I was like, now I'm intelligence. Here I am without even going to former training in actual school. Now I'm actually working intelligence operations in Iraq.
Oh,
And
wow.
it was just mind blowing how exciting that was, because it was an old joke that used to happen. There was a movie called Under Siege with Steven Seagal, where he was a
Huh?
special forces cook. Well, I was the human intelligence cook, and so it was like, it was always the running joke. So,
Yeah.
but the whole point about who I am as a person and as a entrepreneur
Yeah.
is I love to explore. I am never afraid of challenges. And I think for people that are out there listening that are wondering what to do or what your next venture in life is going to be,
Yeah.
just focus and go. And so I found that that's served me very well in life, regardless of, like what you said, an outside the box thinker and mover. That's exactly what I am.
Very nice. So I mean, it's like you have this military thing, and you're this tech geek thing, you're on the move, you're searching, and then you fall into entrepreneurship, right? And then Banta comes along, right?
Absolutely. So, real funny story how I knew I was meant to be an entrepreneur. And it's funny. So, back in the day when I was growing up, we lived in this neighborhood. My dad, who passed away, but my dad, he bought this original Donkey Kong arcade system, right? So, I knew that. I was like, so he disconnected the slot machine so everyone could play for free. So I was like, okay. So I knew in order to make some cash, because for me, it was like, if I wanted something, I had my family growing up. It's like, if you want it, you have to pay for it. So I was like, okay. So that's when you get creative, right? And it's like, okay. And so it's like, so I remember he disconnected the slot machine or the coin slot there, and I would invite all my friends over, but I was like, make sure you bring your quarters to play the game. So after like everyone would come over, I'd take all the quarters, and then now I'm saving up. So I was like, but my dad finally called. I was like, Brian, I told you this is for everybody. I was like, hey, gotta do what you gotta do. So, but from that, even that age, I knew I was born to be an entrepreneur, just because of just the creativeness of not only just going out there and hustling, but creative ways to just
Taking those
make things
opportunities.
happen.
Yeah,
Yep. And
right.
so yeah, so the world of entrepreneurship, and which again led me to now creating Banta Medical Services. So this was co-founded with my partner Guy Banta. He's an aerospace physiologist. Him and I worked together at a company called Eagle Applied Sciences a long time ago,
Okay.
and um, he took me under his wing, and I was doing like, contract risk analysis, facility security operations, all that stuff, right? But during that time with him, and this is why mentorship is so important. I'll get to that in a minute, but um, he took me under his wing, and now I'm working program management and CDC. Now I'm, as a patient, has gone through the healthcare system, which we'll talk about, is now I'm getting actual professional experience in the healthcare and research industry from CDC, NASA,
Right.
uh, Department of Defense on in. So because of his mentorship, I now, in my intelligence background, I was able to really open up my mind, because as a person going through the healthcare system, as you said, that there was a lot of things that I saw that worked, and most importantly, I saw that didn't. And I feel like
From
every
the patient perspective.
precisely.
Yeah.
So the tools I had as an investigator, combined with now being a person in the patient in the system, it actually gave me two very interesting perspectives. And because I'm now going through aggressive medical treatments. And that's when I started realizing the importance of having critical data to help understand to better a person's care plan. Because one of the things I'll tell the audience here is that I ended up with epilepsy, and so as a result to all this, and any of those who out there who have epilepsy can understand that it's a very frustrating trial, right? It's trying to adapt on how to live, how to navigate, and most importantly, trying to control the seizures. Even today, it's still a fishing expedition, even though no one will go out and say it, but it really is trying to understand how to control each individual person's condition. So now going through with epilepsy, really understanding the importance of having that critical data from a preemptive side and just maintaining side, right? But a lot of that data was missing because you're not 24/7 in a clinical setting.
Yeah. So is that kind of where Banta comes in and offers services to kind of fill that void?
Absolutely. So part of that is we take every approach with how we look at, and I'll kind of back up here for a second about, again, I don't think I quite addressed who Banta is. So we are a life science and research consulting firm. And there's a lot of research consulting firms out there. And for us, we're very passionate about the consulting aspect because of the things that each individual executive within the organization has personally been through on the health side to help drive our research initiatives and working in tandem with research, academic, federal government organizations. So our area is to consult with these organizations and institutes to help drive innovation with biomedical technology and health software technology, all that stuff. So we're we're the experts that come in and consult with these firms to continue to drive and improve on initiatives.
All right,
Hope that
so
makes sense.
that's pretty cool. No, it makes total sense. I mean, I love what you guys are doing. I love your story, and it kind of really explains, the trajectory, the whole journey, and then boom, where Banta falls in. So we were talking about small data, right? And
Yes,
where that comes into play. And so we then started this discussion about closing the gaps. And you mentioned closing the digital gaps and closing the physical gaps. And there are a couple of initiatives that you all have going right now to meet both of those. Maybe we can start with the whole digital gaps. Uh,
absolutely, and
examples,
we
this, yeah.
absolutely we see like the digital gap in the very basic of senses is, let's take your smartphone for example, right? Your smartphone device or piece of technology can now create access to a cloud-based system, which everyone's coming out with, that gives you access to your own EHR, your health data. So that's the digital side, right? So everyone's focused right now on closing that digital gap because, in a sense, digital can go farther than your actual physical access, because physical access means you need to put a building or you need to put people in place. So the physical access tends to be lacking over the rapid drives and initiatives that are coming out in the digital side. So, and that's everything from our own wearable technology to software. So the digital gap is closing, but it's also important to remember that even in community-based organizations and community care organizations or CCOs, the important thing to remember is that the physical aspect must always be maintained, because it's not enough to just put some technology out in the world and say, now you have access to things, now we're closing the digital gap. Well, that's not enough for the everyday patient or the everyday person on how it's improving their quality of life.
I
And
mean, you
so
still need the human interaction, right? I mean,
precisely.
so isn't that one of Maslow's identified needs on the Maslow hierarchy? Maybe I'm misspeaking, but definitely human to human interaction. I don't think ever will go away, but the digital stuff will augment what we can get out of it, right?
Exactly. Yep.
Kind of
And
efficiencies. Yeah.
you're exactly right, T. And to me, that's where now my experience of the military comes into play, right? Is because we've seen what the military does in terms of deployments for everything from infrastructure to healthcare, right?
Yeah.
But that's all military oriented. Like here in Texas, for example, we have rural hospitals that shut down yearly, right? Because of budget cuts and things of that nature. But what happens when those rural hospitals shut is now the communities are now lost without direct access. And to me, we see this across the country all the time. When budget cuts hit and funding gets taken away for certain things that are related to Medicare, Medicaid, that the ones that really take the beating are those rural hospitals that are actually that net for
Right.
community care.
Yeah.
So therefore, the communities are starting to lose out. And even in New York, right? It's so amazing where you can see, hospitals like Mount Sinai across one street, and then across the other street, it's a very rural borough area, right? So it's like with no direct access. It's so mind blowing that the disparity can be so close together, but still worlds apart.
Yeah. Yeah.
So when we come back to talking about the data, and how this kind of brings us back is, like with epilepsy, you have people in these underserved areas, whether it's in an urban area or a rural area, that we talk about all the time of, predictive health and all that stuff of that nature, right? But what I've learned in my own journey, even through epilepsy, is how one piece of small data can really paint a big picture. And so we're focused on putting all the big data together, right? But
Right.
little data, for example, like we learned this with COVID, right? Is that there were so many different symptoms, right? And then when people started having those individual symptoms, that must be COVID, right? Because there was confusion around what that one piece of information meant. But
Yeah.
that's not telling the whole story about that person's health.
Right.
And so this data now collectively starts to determine what is really going on in that individual's life versus just one siloed piece of data.
And can help you understand what your next best action is for a particular individual should you get it in time.
Precisely.
Yeah.
And then
So,
that's,
yeah, you were talking about some wearables that the company had developed where individuals were wearing the wearables and the wearables could communicate. I mean, some real sci-fi stuff. The
right.
wearables can track and monitor and take data and send it back, and the patient doesn't have to do anything. They don't have to press any device. They don't have to stand on a scale or anything like that. It sends back, information from the wearable, like key things, and I guess like pulse or whatever is important. But did you all develop anything for epilepsy, the epilepsy condition, or was that specific for another condition? Um,
No, it started out with epilepsy, and again, the biggest way to really capture that critical piece of data is really by studying the brain, right? Because that's where you're going to get your real symptoms. But the hypothesis that we were testing is using existing wearables that are out on the marketplace now, or even stuff that we create. How can we unlock certain events or basically interpret certain events that are leading to something else? So it's kind
right,
of like in our website, kind of like where we talk about a seismologist. What if we can study or predict medical conditions better than earthquake? It's like a seismologist studying for an earthquake, right? Is that there may be certain things that trigger other events that lead up to the main event. So like a seizure, we know stress, sleep deprivation, all those things can trigger the event. But what if there's other factors that start minutes, even an hour ahead of time, right? To help us understand what is really going on into that person before the event actually occurs.
right. So if you could like track a person, keep tracking, keep collecting and sending back data, you say, okay, we have these 10 things. If you have these 10 things happening at this point in time, you could be looking at a seizure coming up. Okay, we have thing number one, check, that's happening. Thing number two, okay, that's happening. Thing number three, okay, and then once we get to thing 10 and all are in place, boom, send an alert, right? Like we may have a seizure on its way to the primary care provider or whomever the care team is, right?
That's
Um,
exactly right.
cool stuff. And it looks like your video has dropped.
Yeah, I just noticed that. Give me one. I apologize for that.
Okay.
Let's see. I apologize. There we go.
Oh,
Okay.
no problem. I could always just cut that out later. So
Okay.
it's
Love it.
real life stuff. So whatever.
Indeed. Exactly. The realities of even tech.
Totally. Um, so you know, I love talking about small data and how folks specifically are using small data, even looking at some specific success stories. I mean, I always feel like patient success stories can really help folks see the true impact or see the real life impact. If you're able to see it from, we started here with this intention, and then here's how we applied it, and this was the impact. Do you have any um, success stories from Banta initiatives using small data or leaning on capturing these little pieces of data and sending it off?
So, for example, when we test piloted our smart wearable clothing, right? one of the things that we did was we tested out in memory care, right? And during this time, we realized, as you see a lot of technology being flooded, the assisted living and senior care space, it's almost it's becoming so so diluted with technology, but it's like, what's the right technology? And a lot of people you see start moving towards like wearable watches and things of that nature. But when you think about the practicality of the technology, does it really blend into that person's everyday life?
Right.
And so a wearable watch for somebody with cognitive issues is not really practical,
Right.
because they forget to put it on or they may require help. So you're really not, that's not a reliable audience for using like wearable watches and things of that nature. So we looked at how wearable clothing plays into the picture, because if somebody with cognitive issues, they're most likely have a care provider or family member that's helping them get dressed.
Yeah.
So the clothing fit them best because, again, that's now it's like out of sight, out of mind. And when we first launched that, there was so much excitement among even the wearers who are like 80 years old. They're like, what? A t-shirt can do all this? It can read my heart? Like, that's like, they were just so fascinated. And so those are the kind of things.
How many t-shirts do you have to have? I mean, you can't
Just
wear
one.
the same t-shirt.
Well, you can, it's washable and all that stuff. And so yeah, you know, obviously everything with tech is not always the most beautiful and sexiest thing but you always have to start somewhere.
That was
So
the next thing I was going to ask. Is it sexy? Like the one you showed
now
me.
it is. Now it is.
It was
Yeah.
very nice and fashionable. Okay.
Yes. Now it's fashionable, ranging from, you know, different styles of how men wear clothes to women, because when we first started, it was a one size fits all kind of same, you know,
Okay.
but that's just to show that the concept worked and, you know, make sure it fits on the body, right? And we see that a lot of the tech. So in that case, when we're doing live demonstrations, within 24 hours, so we had 6 pilot residents. Not a lot of data, but again, the little data is sometimes what matters.
Yeah.
Is we had 6 residents that were hooked up into the program.
Okay.
2 each within 24 hours of hooking up with the smart clothing, we're able to catch AFib. And the doctors weren't even tracking that. And so the first case was within the 24 hours of wearing this clothing, that the nurse and I, we were, you know, working with the lead RN. So we're like, all right, the heart rate is sitting at like 160 beats per minute, which is very high for somebody who's just sitting, right? And so your average resting heart rate shouldn't be anything over 80, right? So if you have a resting heart rate of 160, that's extremely dangerous. But it kept fluctuating. So again, hence there's the tails of AFib, right?
Okay.
And so, but the resident in question, in the scenario, was never articulating that they were having distress. They were just sitting in their chair. And so if you don't see it, you may not know what to investigate. So you're relying on somebody to self-report the event,
Right.
which could also go unreported or later on until it's after it's too late.
Right.
So that piece right now opened up that even that having something like that, right, being able to capture that quickly, right, to now intervene, that's life-saving time, which is I think what all of us in the healthcare tech space are really aiming to do, is get ahead of that event to mitigate something serious.
So you can move quickly, take fast action.
Precisely, because it's life-saving time. And then the second case, there was a resident that would get up in the middle of the night and they would walk to the bathroom, but they were in memory care as well. They were told not to get up and walk around, and so they would get up at 1 o'clock in the morning on their own, go to the bathroom, and come back. But always the next morning, there was always bruises. They could not figure out what was causing the bruises.
Yeah.
So hooking them up to the shirt with the tracking element, you were able to see that he was getting up and going to the bathroom, and then once he got back, he was so exerted that he would collapse and he would forget about that fall. So we were able to capture those events based on how the body is positioned and moving, and then the accelerometer and gyroscope being able to now determine at that moment he's falling. So now, but you're able to correlate that with the heart rate of when it drops. Now you know that what's going on, that this is now causing the person to drop.
Yeah.
So now you can really direct care plans around that data.
Wow. I mean, my head is spinning with the number of use cases I could think that could be applied to. Not just in the nursing, long-term care setting or with the elderly, which is very important, but with other groups as well. Like
absolutely, diabetes, heart.
Yeah, that was exactly what I was thinking. Yeah.
Yep.
Yeah, I mean, so many use cases. It's blowing. I'm like going through my head right now. I'm going through all of the folks I've talked to on the podcast that are speaking different parts of this story. So they're doing different things, and this piece could add nicely with some of the other things that other folks are doing. But we'll talk about that later. But I love that and what Banta is doing. And to my listeners, definitely in the description of the show, not only will I have Brian's bio, but I'll have a link to Banta. So you can go and take a look at some other stuff that they're working on and whatever's on the website. So yeah, no, that's great. And, so you told me about, how small data is playing into what you all are doing. It's really clear, especially when you gave the examples, the patient examples. That's
right. Yes.
Are there any other initiatives that you guys are getting into right now that you're super excited about that will start generating some more small data at the moment that you're comfortable sharing, or that'll be part two?
Yes, there is some very exciting things that we're doing on the community care front that are specifically approaching community care and closing the gap on the digital and physical access side. So I'd say we make that a part two discussion because it's really, really exciting. And I look forward to sharing that as well, because I think there's areas of what we can discuss there that can help a lot of other people understand how to better improve community care access in their own communities.
Totally. I love it. I love it. Well, Brian, we're pretty much at the end of our time. I really appreciate you joining me to talk about Banta and yourself. Of course, I'm a big fan of yours, and I can't wait to have you on again. I'll try and get on your calendar at some point again. I know it's difficult, but we can do it again. And I really appreciate you joining me today.
Absolutely. And then in closing, I wanted to say to the audience out there that for those that have family members or loved ones that are dealing with things such as like epilepsy, here at Banta, we understand the trials and, of dealing with that kind of lifestyle. And so if you have any questions, feel free to reach out to us and how we could help you on that front, because that's just an area for me as the founder I deal with all the time. And so that's a subject I take very personally as well.
Thank you. Well said. Thank you so much for joining me, and I look forward to having you on again.
Thank you, T.
Thank you for tuning in for today's session. Episode. I really hope that you enjoyed my talk with Brian as much as I did. To subscribe to the podcast, you can join us on Spotify, iHeartRadio, and TuneIn. Look up Let's Talk Small Data with T, no apostrophe. You can also visit eima-inc.com and click on Let's Talk Small Data to learn more about the podcast. And if you're interested in being on the show, or have an idea of someone who would like to be on the show, or just would like to connect with my guests, you can email me at tgonzalez@eima-inc.com. And this brings us to the end of the show. And I want to say, have a wonderful day. And remember, unleash the power of your small data. It's your most strategic asset. Have a good day. I will see you next time. This episode is brought to you by Effective Information Management Assistance, specializing in healthcare small data and offering expertise that goes beyond technology. Visit www.eima-inc.com to learn more about Emma and the podcast